The U.S. House is expected to vote tonight on the Republican budget plan to pay for President Trump's tax cuts. Democrats and some crucial Republican holdouts are worried about gutting Medicaid to pay for it. The public concern is not coming from the Colorado Republicans, whose constituents stand to lose the most from Medicaid cuts. Tonight, Gabe Evans and Jeff Hurd are silent on it. After hours of debate in the House, it's not clear whether the Republicans in the majority have the votes from their party to pass the budget resolution. Democrats are united against the proposal, which would raise the debt ceiling by $4 trillion and provide $4.5 trillion in tax cuts. Large portion of those cuts, $880 billion, would be expected to come from the committee that oversees health care spending, including Medicaid. Republican leadership says Medicaid cuts are not specifically listed in the budget, but rank-and-file Republicans have said that's where the cuts are expected to come from. And then there are some other Republican holdouts who want even deeper spending cuts. Stay tuned for that vote tonight. If Republicans cut Medicaid, the two congressional districts that stand to lose the most in Colorado are represented by two of those Republicans, Gabe Evans and Jeff Hurd. As freshman Congressman Gabe Evans and Jeff Hurd got to know their districts, one thing they surely got to know is how many of their constituents rely on Medicaid for health coverage. According to the Congressional District Health Dashboard from NYU Langone Health, nearly 30% of Hurd's constituents on the Western Slope and in southern Colorado are on Medicaid. That's the most of any congressional district in the state. Evans's district, from Denver's northern suburbs up to Weld County, has 25% of the population on Medicaid. That's the second most in Colorado. Evans belongs to the Congressional Hispanic Conference. Last week, the chair of that GOP group and 7 other Republican members wrote to House Speaker Mike Johnson saying Medicaid is expected to bear the brunt of spending cuts and that, quote, slashing Medicaid would have serious consequences, particularly in rural and predominantly Hispanic communities. Evans did not sign that letter opposing Medicaid cuts. On Monday, as Democrats protested outside Evans's office asking him to protect Medicaid, he posted a photo on social media of his stop 2 weeks ago at Tepeyac Community Health Center, writing that that clinic does critical work with underserved communities. Tepeyac told me that cutting Medicaid would mean, quote, more patients would be forced to seek care in emergency rooms, increasing uncompensated hospital costs and straining the healthcare system. Congressman Evans did not respond to our requests for comment on Republican plans to cut Medicaid. Congressman Hurd did not respond either.